Have you ever quietly looked at yourself in the mirror and wondered, how long will my body stay healthy? Or have you ever looked at a friend or relative who was healthy just a few years ago, but now has passed away too soon? And you feel confused and worried about yourself, your mother, the woman next to you? If you have ever felt like that, you are not alone. In fact, after the age of 60, the risk of death from silent causes begins to increase sharply, especially in women, those who have lived their whole lives for others but sometimes forget about themselves. According to medical statistics, every year millions of elderly people die from causes that are completely preventable if detected early, if warned in time. Unfortunately, most of us ignore the first signs, thinking it's probably okay. That's just how old we are. This video isn't meant to scare you. I'm here to help you realize something important. Health in old age isn't a given, but it can be maintained if we're aware of the risks that are quietly shortening our lives. And watch until the end, because I'll share with you the top 7 causes of death after age 60, especially in women, along with practical tips to help you and your loved ones live longer, healthier, and more peacefully every day. Before going into the main part, I would like to share with you a true story about a 65-year-old woman who was once standing very close to the border between life and death. Just because of a small sign, for many years she thought it was normal. But luckily she realized it in time, and thanks to that, she not only saved her own life, but also rewrote her entire journey of old age in a more complete and peaceful way. This is not only a cautionary tale, but also a gentle reminder for all of us. Sometimes life is not about the big things, but about whether we are awake enough to listen to our bodies or not. Her name was Helen. She was 65 years old that year. All her life, Helen had been a devoted mother, wife, and friend. She was always the one who got up the earliest in the house, cooking breakfast, making coffee, preparing lunch boxes for her husband to take to work, and pre-cut fruit for her grandchildren to take to school. She was quiet, meticulous, living for others as a matter of course, never complaining, never putting herself first. If she was tired, she just smiled gently. "It's okay, let me take care of it." But because of that, she often neglected herself. For nearly a year, her body began to speak up, but she never thought of going to the doctor. "I'm old, so a little tired is natural." She was often tired, but thought it was because she woke up early and had to cook. She ate poorly. She thought it was because the food was bland, not because of her health. Sometimes she felt a little tightness in her chest, but it only lasted a few minutes, so she didn't pay attention. Sometimes, when she was standing, she suddenly felt dizzy. She just leaned on the edge of the table, then continued working as if nothing had happened. She was used to forcing herself, used to not wanting to bother anyone, and used to seeing her fatigue as a natural part of old age. She thought, "It must be because I'm old." And so she continued to cook, garden, pick up and drop off her grandchildren, do the laundry, and clean the house as if nothing unusual had happened. Sometimes she felt sad when she felt tired and no one noticed, but then she brushed it off. "Who has time to care? I'm old. It's good enough that I don't bother anyone." Helen never complained, not to her children nor to herself, until one day, after her granddaughter's birthday party, the house still smelled of cake and the laughter of children. Helen had just finished cleaning, still holding a damp towel. And then she collapsed, right in the middle of the kitchen, where she had stood for so many years as a silent keeper of the fire. Not a cry for help, just the towel falling to the floor, lying silently beside a trembling hand. A seemingly ordinary moment almost became the last. When she was taken to the hospital, the doctor concluded early-stage heart failure. a condition that could have been controlled early on. If those fatigues had not been ignored, if the fainting spells had not been considered normal, if she had put her health on par with the people she loved, she lived for her family but almost did not live for herself. She was lucky, because she was discovered in time. That fainting spell was like a wake-up call, not only for Helen, but for her entire family, who had always believed, Mom is fine, Mom is used to working, Grandma's very strong, don't worry. But after that incident, everything changed. No one considered her silence as a sign of being fine. No one took her suffering for granted. And Helen changed too, quietly but profoundly. She began to listen to her body, the fatigue, the irregular heartbeat, the loss of appetite. She took note of the small changes that she used to ignore. She learned to eat healthily, less salt, more vegetables, just enough protein. Drink water on time, no longer skipping meals just because she was busy cooking for her grandchildren. But most importantly, for the first time in her life, she allowed herself to be loved. Not because she was useful, not because she was a good caregiver, but simply because she deserved it. She allowed herself to rest without feeling guilty, to say, I'm tired today, without fear of bothering anyone. To be cared for, not because she was weak, but because she understood her own worth. Now, at 70, she walks slowly around the neighborhood every morning, holding a small bottle of water, occasionally stopping to admire the flowers along the road. Her lunch consists of a plate of steamed vegetables, lightly grilled fish, and a glass of juice that she prepared herself. She practices meditation, reads books, writes a diary, something she used to think was a luxury. And most importantly, she is no longer afraid to refuse things that make her tired. She is no longer the person who is always ready for everything, forgetting to ask herself if she is tired or not. And every time someone asks about that period, she just smiles and says, I almost wasn't here anymore, just because I was used to thinking of myself as the last person to be cared for. But now I understand. If I fall, who will take my place? To love the people I love. That sentence, as light as the wind, but enough to make anyone who hears it quiet down a bit. Because it reminds us of something that seems simple, but is often forgotten. You cannot take care of anyone if you do not start with yourself. If you are still following this far, perhaps you have realized old age health is not just about medicine or test numbers, but also the story of silent things, the fatigue that is ignored, the small signs that are taken lightly, and the love that sometimes we forget to give ourselves. Don't wait until your body collapses to start caring. Don't wait too late to look back at things that can be prevented very early. Now let's continue. We will explore 7 common but often overlooked causes that can silently shorten life after 60, especially in women who spend their lives serving others but are rarely listened to properly. Understanding to prevent is always the most powerful and humane way to protect life. Don't forget to subscribe and follow to continue accompanying each other. Cause 1. Cardiovascular disease. Cardiovascular disease is one of the leading causes of death in people over 60, especially in women. More dangerously, this is a disease that often progresses silently, quietly, not violently, until it is too late. Why is heart disease common in the elderly? Because when you turn 60, the body begins to lose strength naturally. Blood vessel walls become harder, less elastic. Cholesterol easily accumulates in the blood vessels, causing atherosclerosis. Heart rate gradually slows down, heart contractions weaken. Blood pressure increases, blood circulation is less effective. In women after menopause, women lose the natural protective layer from the hormone estrogen, making the risk of cardiovascular disease higher than men of the same age. Therefore, women over 60 are prone to high blood pressure, heart failure, myocardial ischemia, and stroke due to coronary artery occlusion, signs that are easily overlooked because they are thought to be normal. Many people, like Helen, have heart disease but do not know it because the symptoms are often vague and easily confused. For example, some warning signs of heart disease that are often overlooked: being tired, short of breath even without much exercise, feeling dizzy when standing up, mild transient chest pain, swollen legs, ankles then go away on their own, abnormally fast heartbeat when resting, difficulty sleeping, waking up in the middle of the night with anxiety. Many people think that this is normal in old age, but it is this subjectivity that causes the disease to progress silently and dangerously. How to prevent and improve cardiovascular health after age 60. You cannot rejuvenate your blood vessels, but you can absolutely keep your heart healthier every day with just small changes. 1. Get a cardiovascular checkup every 6 months, especially if you have a history of high blood pressure, diabetes, high cholesterol, or have ever smoked. 2. Maintain a heart-friendly diet. Limit salt, animal fat, refined sugar. Increase green vegetables, fish, beans, fresh fruit, oats. Drink enough water, but avoid drinking too much in the evening. 3. Exercise gently and regularly. Walk 20 minutes/day. Practice deep breathing, yoga for seniors, or health care. 4. Manage emotional stress. Get enough sleep. Limit staying up late. Talk to relatives. Join a senior club. Spend time on activities that make you feel peaceful, reading, meditating, gardening, etc. 5. Take medication as prescribed if you have an underlying disease. Do not stop taking blood pressure or heart medication on your own. Always consult your doctor if new symptoms appear. Note: women over 60 years old can have a heart attack without chest pain like men. Symptoms may only be unusual fatigue, mild nausea, unexplained anxiety, or shortness of breath when lying down. Don't wait for a heart attack to know you have a heart problem. Listen to your body. From the smallest signals, cause 2, stroke, cerebrovascular accident, especially women. Stroke, also known as cerebrovascular accident, is one of the highest causes of death or disability. It can happen while talking, eating, or sleeping, and just a few minutes of delay can cause irreversible consequences. Why are the elderly susceptible to stroke? Over time, the brain's blood vessels gradually weaken. In addition to risk factors such as prolonged high blood pressure, the #1 cause of stroke, dyslipidemia, atherosclerosis, making it difficult for blood to reach the brain, diabetes damages the blood vessel wall, prolonged psychological stress, poor sleep, chronic insomnia, lack of exercise, salty food, smoking, drinking alcohol. In postmenopausal women, decreased estrogen levels also make blood vessels more fragile and sensitive, increasing the risk of vascular occlusion and cerebral hemorrhage. Stroke warning signs, often overlooked. Some people don't even know they're having a mini stroke because the symptoms are often subtle or fleeting, such as mild numbness or weakness in the face, arm, or leg, usually on one side of the body. Slurred speech, difficulty speaking or difficulty understanding what others are saying. Dizziness, lightheadedness, loss of balance. Blurred vision, double vision, or loss of vision on one side. Sudden, severe, unexplained headaches. The scary thing is, these signs only last for a few minutes and then disappear, causing many people to ignore the first warning from the brain. How to effectively prevent stroke after age 60. You can't know when a stroke will happen, but you can absolutely do everything to make sure it never happens. 1. Controlling blood pressure is a top priority. Measure your blood pressure every day. Take medication as prescribed. Avoid prolonged stress and anxiety. 2. Eat a balanced diet. Reduce salt, reduce fat, eat lots of vegetables and fruits. Limit alcohol, don't smoke. Control your weight and blood sugar. 3. Increase light exercise every day. Walking, yoga, swimming are all good. Avoid lying down too much or sitting for too long. 4. Get enough sleep. Keep your mind relaxed. Sleep 6-7 hours every night. Listen to music, meditate, read light books, participate in community activities, chat with relatives. 5. Remember the FAST principle, including 4 factors: F, face, distorted face, one side of the mouth droops. A, arm, weak arm, can't lift, especially on one side. S, speech. Time, golden time. Call an ambulance immediately if any of the above signs appear. If you detect one of the first 3 signs, call an ambulance immediately. Every minute is precious to the brain. Stroke is an unforgiving disease. It doesn't wait for you to be ready, and it doesn't give you a chance to correct your mistakes if it's too late. So, don't ignore those fleeting dizziness, the loss of balance, or the strange feeling in your body. Your body is always trying to tell you something. It's just a matter of whether you listen at the right time or not. Remember, you can forget to take your medication, you can skip a meal, but please, don't ignore the silent warnings from your body, because sometimes life is only 1 minute away from death. Cause 3, cancer, especially breast, lung, colon cancer, does not appear overnight. It grows silently from things we once thought were harmless. After the age of 60, the immune system weakens, the cell repair process slows down, combined with the cumulative effects of lifestyle and environment, making the risk of cancer in the elderly increase. In women, the 3 most common and dangerous types of cancer are breast cancer, lung cancer, and colon cancer. Unfortunately, most cases are detected at a late stage when treatment is already very difficult. Breast cancer. Not just a young woman's disease. Many people think that breast cancer mainly occurs in middle-aged women, but in fact, the highest risk is in women over 60 years old. After menopause, hormonal changes make breast tissue cells more sensitive to mutations. In addition, if the patient has a family history, is sedentary, has used hormone replacement therapy, or has had children late in life, the risk is even higher. Sadly, early-stage breast cancer is almost painless and not uncomfortable. Many people only accidentally discover a tumor when they feel something hard in their breast, or when the breast changes shape, the nipple is retracted, or there is a strange discharge. But at that time, the disease may have progressed further than imagined. The best prevention is self-examine your breasts every month, get regular screenings every 6 months, get mammograms as recommended by your doctor. Lung cancer is even if you've never smoked. Lung cancer is one of the most deadly cancers in both men and women. For older women, even if they don't smoke, living in a polluted environment, being exposed to kitchen smoke or breathing in secondhand smoke for a long time is also a serious risk factor. Symptoms of early-stage lung cancer are easily confused with common diseases: persistent cough, fatigue, chest pain, slight weight loss, wheezing. Older people often think it's cough due to old age, allergies, so they ignore it. Only when they cough up blood or have severe difficulty breathing do they go to the doctor, and by then the disease is already in its late stages. Preventive solutions. Regular lung examination, especially if you have lived near smokers or those who cook with coal or wood. Chest X-ray once a year. Keep the air in your home well ventilated. Maintain a healthy lifestyle, eat lots of green vegetables and fruits, and avoid exposure to toxic smoke. Colon cancer. When the digestive system is no longer silent, colon cancer is the silent type of cancer. Because it starts in the intestines, it rarely causes obvious symptoms. After the age of 60, the digestive system becomes sluggish. combined with a low-fiber, high-red meat sedentary lifestyle, increasing the risk of polyps developing into cancer. Signs that are often overlooked are prolonged digestive disorders, changes in bowel habits, constipation mixed with diarrhea, bloody stools, and unexplained fatigue. Because these symptoms are easily confused with common digestive problems, many people are subjective. Prevention and early detection. Colon cancer screening, colonoscopy or stool test from age 50 onwards. Eat plenty of fiber, vegetables, fruits, whole grains, limit red meat, fried foods. Exercise regularly to support bowel movements. Cancer does not choose anyone, but each of us can choose how to live, how to eat, how to prevent the disease so that cancer is no longer a predetermined sentence. Remember, early detection of cancer can save your life. Don't be afraid to go to the doctor. Don't wait until you are in pain to listen to your body. Reason 4, Alzheimer's and dementia. What's your name? A seemingly harmless question, but it brings many people to tears. Because when memory begins to leave us, the feeling of being lost does not come only from forgetting, but from the fear that we are gradually becoming a burden. Dementia and Alzheimer's are slowly progressive neurodegenerative diseases, commonly occurring after the age of 60 and increasing rapidly after 70. The rate of women is higher than men due to longer life expectancy and the effects of menopause on brain function. This is not normal forgetfulness, but a serious decline in memory, language, thinking, and gradually the loss of the ability to care for oneself. Early signs are often overlooked. Patients often forget names, misplace things, repeat sentences, become disoriented in familiar places, or have difficulty with daily tasks such as cooking and calculating. Personality also changes, quiet, anxious, irritable, withdrawn. Because the progression is slow, many families mistake it for normal signs of aging and miss the opportunity for early detection. Why is Alzheimer's a dangerous cause? Although it does not cause immediate death, cognitive decline has many serious consequences. Patients forget to eat, forget to take medication, easily get lost, fall, and are hospitalized. Lose the ability to care for themselves, become completely dependent. Mental breakdown, depression, living in anxiety because they themselves do not understand what is happening to them. Prevention and improvement. Although there is currently no cure for Alzheimer's, early prevention and proper intervention can slow the progression, helping patients live more independently and happily for a long time. 1. Exercise your brain every day. Read books, write a diary, solve crossword puzzles, learn new things, chat regularly, participate in community activities. 2. Exercise regularly. Walking, yoga, tai chi help increase blood circulation to the brain. 3. Good nutrition for the brain. Eat lots of green vegetables, fatty fish, omega-3, berries, nuts. Limit refined sugar processed foods. 4. Stable sleep and psychology. Get enough sleep, avoid staying up late, reduce stress by meditating, listening to music, talking to relatives. 5. Screening and early detection. If there are suspicious signs, forgetfulness, behavioral changes, take your loved one to a neurologist or geriatrician for a memory assessment. When an older person begins to forget, they don't need to be scolded. They don't need to hear that they are losing their mind. They need a knowing look, a firm hand to hold, and someone patient enough to repeat each thing with love, not weariness. Because memory may fade, but love is always there, even when the name is no longer known. Cause 5. Falls. The danger doesn't always come from illness. Sometimes just a minor fall can rob you of your freedom, your initiative, and even your dignity as an old person. Falls are the leading cause of serious injury in people over 60, especially in women. The older you get, the thinner your bones become, the greater your risk of fractures. A seemingly simple fall can lead to a broken femur, a traumatic brain injury, or permanent loss of mobility. Why are falls so dangerous? In older people, bones and joints are weak, reflexes are slow, vision is reduced, and balance is easily lost. Add in slippery floors, high stairs, poor lighting, medications that cause dizziness, or diseases like Parkinson's, Alzheimer's, all of which create a silent trap right in your own home. A fall not only causes injury, but also leads to loss of ability to walk, complete dependence, risk of pneumonia, skin ulcers due to lying down for a long time, and more seriously, loss of self-confidence, leading to depression and living quietly. There are old people who used to go to the market every day, cook alone, tend the garden. After just one fall in the bathroom, they had to stay in the hospital for 2 months, then sit in a wheelchair for the rest of their lives. There are also people who fell at night without emergency care and passed away forever, leaving behind endless regret for their loved ones. And the most heartbreaking thing is, many falls are completely preventable if prepared early. Prevent falls. Protect your old age. 1. Adjust your living space to be safe. Install handrails in the bathroom and stairs. Avoid slippery floors and loose carpets. Ensure adequate lighting, especially at night. Use non-slip slippers, flat-soled shoes, and do not go barefoot. 2. Check and support your vision and hearing. Wear glasses with the right prescription. Get regular eye exams. Avoid walking in low light or disorientation. 3. Exercise to increase muscle strength and maintain balance. Practice Tai Chi, yoga for the elderly, or walk every day. Practice light exercises to increase reflexes and flexibility. 4. Pay attention to the medications you are taking. Consult your doctor if you are taking medications that can cause dizziness or low blood pressure. Avoid standing up too quickly after lying down or sitting for a long time. 5. Maintain nutrition for strong bones. Supplement calcium, vitamin D, omega-3 from food or as prescribed. Eat enough protein, drink enough water. Avoid weakening the body. Don't wait until someone falls to install handrails. Don't wait for something to happen to fix the steps. A small preparation today can be exchanged for a lifetime of safety and peace. Because the most valuable thing after the age of 60 is not living long, but living proactively, not depending, not being afraid. Cause 6. Chronic obstructive pulmonary disease, COPD. Have you ever noticed that just breathing can sometimes make a person so tired that they want to give up? COPD, chronic obstructive pulmonary disease, is one of the most dangerous respiratory diseases in people over 60 years old. The disease progresses silently, causing prolonged coughing, shortness of breath, fatigue, and decreased mobility. More worryingly, COPD is the leading cause of death in the elderly, after heart disease, stroke, and cancer. Why is COPD common in the elderly, especially women? COPD is the cumulative result of years of exposure to dust and pollution, especially cigarette smoke. Many women have never smoked in their lives, but live in an environment with coal stoves, wood stoves, or inhale cigarette smoke from relatives and silently carry lung damage for decades without knowing it. After the age of 60, resistance decreases, the lungs lose elasticity, and the airway mucosa is susceptible to chronic inflammation. The air sacs are damaged, making breathing once so natural more difficult every day. Early signs are easy to overlook. COPD does not come with a severe shortness of breath. It starts with very normal symptoms: dry cough or cough with phlegm that lasts for weeks, shortness of breath, fatigue after walking just a few steps, feeling of tightness in the chest, heaviness in the chest, difficulty sleeping at night, difficulty breathing when the weather changes or when lying down. Because these symptoms are very similar to sore throat, flu, weakness, many people only treat the symptoms without knowing that they have a dangerous chronic disease. How to prevent and control COPD after age 60? COPD cannot be completely cured, but it can be well controlled to prolong life and improve quality of life if detected early and cared for properly. 1. Quit smoking and avoid cigarette smoke completely. This is the most important factor. If your loved one smokes, clearly explain the harmful effects to the elderly around them. 2. Improve the air in the house. Open the ventilation doors. Avoid kitchen smoke, fine dust, strong cleaning chemicals. Plant trees to filter the air, keep the house cool. 3. Maintain gentle exercise. Practice deep breathing, abdominal breathing, restorative breathing exercises. Walk slowly, do yoga to increase endurance and oxygen to the lungs. 4. Good nutrition and adequate rest. Eat lots of green vegetables, vitamin C, omega-3 to reduce inflammation. Avoid eating too much at night because it can cause difficulty breathing when lying down. 5. Regular health monitoring. Measure lung function if there are signs of suspicion. Use inhalers and bronchodilators as prescribed by your doctor. There are people who used to be breadwinners, working hard all their lives, but at the end of their lives just breathing becomes a struggle. Don't let every breath be a struggle. Protect your lungs with understanding, care, and love at the right time. Living long is a blessing, but breathing easily and freely is living fully. Reason 7. Depression and suicide risk. I live, but I don't feel like I'm living. If you've ever heard that saying from an older person, you'll probably understand that depression is not just sadness, but the feeling that you've been forgotten by the world. Depression in people over 60 is often misunderstood as old age sadness, while in fact, it is a disease that needs to be treated. More dangerously, depression in the elderly not only lasts for a long time, but also increases the risk of suicide, especially when there is an underlying disease, loneliness, or a feeling of abandonment. Old age is a period of many losses: the passing of loved ones, declining health, loss of role in the family, and decreased social connection. Feelings of uselessness and being forgotten easily cause the elderly to withdraw into silence, and from there fall into depression without realizing it. Along with that is the feeling of fear of not being able to control the body, not wanting to become a burden, or feeling that one is living a quiet life without a voice. These things, if not shared, not listened to, will gradually create a silent darkness, causing the elderly to withdraw, gradually lose faith in their own worth, and finally, the thought of ending their life. What can you do to help older adults overcome depression? Listen without judgment. Avoid saying things like, "You think too negatively." Instead, ask gently, "Is there anything that makes you sad lately?" Stay connected every day. A phone call, a walk, or a cup of tea can help them feel loved. Create meaningful habits. Encourage gardening, journaling, listening to music, and joining clubs to add joy to life. Get professional support. Depression is a disease that can be treated with psychotherapy, medication, or group therapy. Don't be afraid to take your loved one to the doctor. Comprehensive care. Eating a balanced diet, exercising lightly, sleeping well, and controlling underlying diseases are the foundation for a more stable spirit every day. Don't think, "I'm old, I can live however I want." The elderly still feel lonely, sad, and hopeful like anyone else. Just one person listening and caring at the right time is enough to keep them in life, even if they once wanted to leave quietly. We cannot stop aging, but we can choose how to live each day of old age. The story of Mrs. Helen is the image of many women sacrificing their whole life for others but forgetting to take care of themselves. When their bodies speak up, they just smile, "It's okay, I'm used to it." But the scariest thing is not illness, but silence. when tired, when sad, when scared. And that silence can lead to irreversible consequences. Together, we have seen clearly 7 silent causes, from heart disease, stroke, cancer, to depression and falls, things that seem normal but can take away a life in the blink of an eye. But thanks to understanding, we can prevent early, take care of ourselves properly, listen promptly, and love more fully. The elderly do not need a lot of medicine, but need to be listened to, understood, and feel that they are still valuable, still loved. If you are at that age, remember, you are not out of date. This is the most worth living time if you know how to love and take care of yourself, because you deserve to live peacefully, proactively, and fully.